In recent years, the United States has witnessed an unparalleled surge in immigration, with thousands of individuals crossing into the country through key entry points in Texas, Arizona, and California. Bill Gates, along with the members of the World Economic Forum, also known as the WEF, have warned of another pandemic that will in fact be coming, and it will be far worse than what we experienced just 4 short years ago.
Now a new warning 1,000 miles away in New York City, where officials tell us resources are overwhelmed. Across public hospitals in New York City over the last year, nearly 30,000 visits by migrants and 300 new babies born to migrant moms.
In fact, this influx of migrants has funneled a substantial number of new residents into major urban centers such as New York, Chicago, Denver, Colorado, and Los Angeles, just to name a few.
To the issue of the day, the very latest from the porous, wide-open southern border, with a record 302,000 illegal migrants encountered at the southern border in December alone. President Trump, just a moment ago, telling me in an exclusive interview his plan to solve the crisis at the border will include deportation of most of the 10 million illegals already here after they entered illegally under the Biden administration.
Now, this particular migration, driven by the quest for better living conditions and, of course, the allure for more accommodating state policies, has only enriched these cities with cultural vibrancy, but it has also presented itself with some significant challenges to their existing infrastructures. Now, while some are women and children genuinely seeking asylum, there is clearly a large number of military-aged men who are coming across the southern border in Texas in alarming numbers for a variety of reasons that we will get into later in this video. Now, before we do, only thing I ask of you guys is to do me one quick favor. It only takes a second. If you can hit the like button for the video, I really would appreciate that. Now, among the most pressing concerns arising from this demographic shift is the potential for widespread disease outbreaks.
And I want to be careful here, because one of the real stereotypes of immigrants is they bring disease. We've heard about that. People said that about my immigrants when they came over from Ukraine in the early 1900s. But the fact of the matter is the people who are being sort of either let out and or the people who got away are not going through any of the screening that normal legal immigrants into the United States get. Tuberculosis by state. New York City's TB rate, 6.1 cases per 100,000, more than double the national rate. Florida, 21% increase in TB since 2020. Texas border counties have a TB triple the national average. And tuberculosis is weird. You know, obviously this better than I do as an emergency room doctor, but that it can be latent for 6 months. And I'm wondering, is there a ticking time bomb that is now coming into the United States through no fault of these people's own, but it still is going to affect all of us?
Now, this rapid increase in population density, particularly in urban environments where healthcare systems and public services are already under strain, it sets the stage for public health emergencies that could very well have far-reaching implications, potentially across the entire United States, all 50 states for that matter.
Two, not only about tuberculosis, or what's even worse, drug-resistant tuberculosis. Those strains are out there, less likely in Central America and South America because they haven't been treated. But is the loss or lack of vaccinations, you know, whooping cough and things like that, are also coming into the country.
And this could very well be setting the stage for the next pandemic that members of the World Economic Forum and the World Health Organization have predicted. As cities grapple with the demands of their growing populations, the risk of contagious diseases is spreading among tightly packed communities, becoming a stark reality. Now, this scenario, it threatens not only the well-being of immigrants themselves, but also that of the broader population, posing very serious challenges to our healthcare providers and our public health officials. Now, the implications of such a health crisis, it extends well beyond the immediate concerns of disease management and healthcare provisions. They also have the potential to exert considerable pressure on our economy as resources are diverted to address public health needs and the workforce is impacted by illness. Beyond that, the strain on healthcare systems could lead to longer wait times, reduced access to services, and of course, increased healthcare costs for all residents, not just migrants, but Americans too, further exacerbating social and economic disparities. Immigrants are entering the United States through key points such as Texas, with Eagle Pass being notably common.
Let me get your take on what's going on in New York. We understand now New York is going to be spending $53 million to come up with prepaid credit cards for the illegal migrants. What do you think's behind this? Why do they need prepaid credit cards?
It sounds like insanity is behind it, because it really is offensive. It may be the most reprehensible thing that I've seen take place over the past 48 hours when you see police officers in New York City being beaten by illegal immigrants in this country who should not be in the country in the first place. And then after they engage in this crime against a law enforcement officer, they are let loose back out onto the streets. What's going on in New York is outrageous, and Americans across the entire country are angry, not just about what's going on in New York, but the underlying cause for it, which is Joe Biden's open border policy.
You got Arizona as well as California, driven by the promise of more accommodating state policies and the allure of economic opportunities. This influx is directly towards major urban cities like New York, Chicago, Illinois, and Los Angeles, California, which are perceived as hubs of opportunity and havens offering supportive community networks and state policies, not to mention a ton of freebies. Factors driving immigrants to urban centers, for example, urban centers offer a lot of different job opportunities, from entry-level positions to careers that require specialized skills, attracting individuals seeking better economic prospects. Now, this is putting a lot of concern on people who already live here in America, on Americans, because they are seeing this increased competition, and it could make getting a job a lot more difficult. We also cannot ignore the freebies that many cities are offering to migrants, such as NYC. New York City is offering migrants up to $1,000 a month. So New York City launched a $53 million program to hand out prepaid cards to migrant families. Now, according to state policies, you got states like California, which has implemented policies that provide health care benefits and other forms of support to low-income immigrants, making these particular areas very attractive. Illegal immigrants and their U.S. citizen children may be eligible to receive emergency medical care, Medicaid care services, primarily for emergency medical situations. But in addition to that, undocumented immigrants, including their children, have access to primary and secondary education here in the United States, as well as public schools do not require proof of immigration status for enrollment. So basically, anyone can come in and flood the schools. And so the immediate consequence of this migration surge is a very significant strain on our city's infrastructures, particularly housing, education, and healthcare services. And we can't forget about housing, right? So this rapid increase in urban populations, it only exacerbates the existing pressures on our housing markets, leading to overcrowded living conditions, a spike in rent prices, heck, even a spike in housing prices. Many families find themselves sharing small apartments or living in substandard conditions as the demand for affordable housing far outstrips its supply. Then, of course, you've got urban healthcare systems already dealing with the challenges of serving large and diverse populations. They're facing additional pressures as the number of residents requiring medical services increases. And so this surge in demand can only lead to longer wait times, resource shortages, and overstretched healthcare providers. Now, the combination of overcrowded living conditions and the strained healthcare services, it creates a fertile ground for the spread of contagious diseases, raising the risk of public health emergency, right? Now, overcrowded housing facilitates the rapid transmission of communicable diseases. When people live in close quarters, illnesses like the flu, tuberculosis, and the measles can spread much more easily, compounded with the challenge of inadequate ventilation and sanitation in such living conditions. So the strain on healthcare services means that many immigrants, particularly those with legal status or adequate health insurance, may avoid medical care due to cost. They may avoid medical care due to fear of deportation or even the lack of information about the resources available. Now, this delay in seeking treatment can lead to far more severe health outcomes for the individual and further facilitate the spread of diseases within that local community. And then, of course, you got limited access to healthcare services. They can also affect vaccination rates, the implementation of preventive health measures among immigrant populations, increasing the vulnerability of the entire community to outbreaks of vaccine-preventable diseases. Now, the confluence of these factors driven by migration patterns, the appeal of urban centers, and of course, the resulting impact on city infrastructures, it only highlights the urgent need for comprehensive policy responses. And these responses, they must address the housing shortages. They have to enhance healthcare service provision and ensure access to preventable health measures in order to mitigate the risk of public health emergencies and protect the well-being of our urban residents. Either that or just go ahead and close off the borders altogether. Now, the population increase in urban areas, it has really put healthcare systems under considerable strain, manifesting itself in several different ways. Like, with more individuals seeking medical attention, healthcare facilities are finding it increasingly difficult to provide timely care. This includes longer wait times for individuals, overcrowded emergency rooms, and stretched thin medical staff. The quality of healthcare can also suffer as providers try to manage higher caseloads with limited resources. You got healthcare professionals, they may experience burnout, leading to decreased patient care quality, and of course, the increased likelihood of medical errors. Many of these urban healthcare systems are already operating at or near capacity before the recent influx. And so this additional demand, it only exacerbates the existing infrastructure limitations. And then, of course, the heightened risk of contagious diseases, the dense living conditions in urban centers, coupled with the recent population surge, this is literally setting up the grounds for an outbreak. And then you have diseases like tuberculosis, measles, and the flu, which can spread much more quickly in crowded settings, such as shared housing, public transportation, buses, trains, community centers, common among immigrant populations. Then, of course, immigrants, particularly those without legal status, may have lower vaccination rates due to barriers in accessing healthcare services in their original countries. And so this basically creates pockets of unvaccinated individuals, increasing the community's vulnerability to outbreaks of vaccine preventable diseases. So the fear of deportation or even legal repercussions can also deter immigrants, especially those without legal status, from even attempting to get medical care. And, so addressing these challenges definitely requires a concerted effort to expand healthcare services and infrastructure. Many people are calling for the borders to simply be closed. This is a problem that is greater than what we can possibly handle here in the United States. So now allocating more resources to healthcare facilities and urban centers could theoretically help the demand for services and improve the quality and reduce the wait times. But this will come at a significant cost. And the cost will, of course, be carried by the backs of millions of American tax-paying citizens if this is in fact the case. Now, developing healthcare services that are culturally sensitive and accessible to non-English speakers could improve healthcare access to immigrant populations, but these would literally be band-aids to a shotgun wound. Then, of course, creating integrated healthcare solutions that could address the specific needs of immigrant populations, including mental health services, preventative care, chronic disease management. These could all theoretically improve the overall community health outcomes, but there are no guarantees. And, of course, the resulting population density in cities like New York, Chicago, Los Angeles, not only strains local healthcare systems, but it also sets the stage for a broader dissemination of infectious diseases. And the movement of people within the country, whether for economic opportunities, family reunification, or for other reasons, this can also facilitate the spread of diseases to other states outside of these main cities that I've mentioned, both directly connected to these urban centers and also along some of the key migration paths. So some of the states that are directly at risk, obviously New York, California, and Illinois. So these states housing major urban centers are at immediate risk due to these dense populations. And of course, the status as primary destinations for new immigrants. Now, the concentration of people in these particular increases. It increases the potential for disease transmission, not only within the state, but also the neighboring regions. So states in close proximity to these urban centers are New Jersey, you got Connecticut, which is near New York, you got Nevada and Arizona, which is near California, and of course, Wisconsin, Indiana, and Missouri, which is near Illinois. All of these states are at heightened risks. So if you happen to live in these states, or if you know anyone in these states, definitely share this video with them. The geographical closeness and interconnectivity through commuter and transportation networks, it facilitates the movement of people and potentially also helps to spread the diseases, which is exactly what we don't want, right? And of course, as a major entry point and a state with very significant internal migration, Texas acts as a conduit for the movement of people further inland and toward these states, busing people out of the states, sending them to these different migrant-friendly states and cities, basically carrying the risk of spreading diseases encountered at the border or within the state throughout the country. And of course, you got Colorado, Utah, and Oregon, not to mention Washington. They could also see surges, increased migration from individuals that are moving from their initial entry points or overcrowded urban centers seeking employment or less crowded situations. Even migrants are saying that resources are getting low, they're getting slim. And states have to share information about these outbreaks and disease trends in order to anticipate and respond to potential spread. Real-time data exchange can also help public health officials implement targeted interventions. Then, of course, during outbreaks, resources like vaccines, personnel, emergency supplies, they may need to be reallocated to areas that are experiencing surges in disease cases. Interstate agreements, they can facilitate the rapid deployment of these resources where they're needed most. So there are ways that we can address this, but in all honesty, most are probably saying that the easiest thing that we should be doing is address the problem that what is happening right now is completely illegal. And the quickest solution would be to close the borders. Many Americans are crying out for deportation of people who have entered the country illegally. And so, it's a rather alarming situation. Now, addressing the public health concern, in densely populated areas, presents some very unique challenges. And we've seen this already as various global contexts, including China, have already experienced this. In fact, China's experience with managing public health, particularly in cities like Beijing and Shanghai, they provide valuable lessons in handling outbreaks and maintaining public health amidst overcrowded conditions. This ended up resulting in lockdowns and such, right? And so let's look at some of the things that have taken place in China, because we've already seen this happen before, and we know that history has a tendency to repeat itself. And so, back in 2003, and of course the COVID-19 pandemic, which began in 2019, technically, to really understand the complexities and the strategies that were employed in China in terms of managing public health in densely populated settings. So if we look at SARS outbreak of 2003, right? The outbreak of the severe acute respiratory syndrome, or also known as SARS in 2003, tested China's public health response in an era of rapidly urbanizing and population density. And so the virus, characterized by a very severe respiratory symptom or a multitude of respiratory symptoms, it spread very quickly in crowded urban areas, highlighting the challenges of controlling infectious diseases in densely populated environments. And of course, the high population density in cities like Beijing facilitated the spread very quickly of this particular virus, and it overwhelmed the healthcare facilities almost instantly. Then you got initial delays in acknowledging the whole, communicating of the severity of the outbreak. It also helped to hinder containing these particular diseases and viruses. And so the sudden surge in SARS cases, it put immense pressure on the healthcare system, exposing gaps in emergency preparedness and also the capacity to be able to handle these epidemic situations. And so, this is just one situation, but we've even had one more recent than that. If we look back at 2019, the whole COVID-19 pandemic originating in Wuhan, China, it presented an unprecedented challenge with the virus spreading rapidly in one of the most populous countries in the world. China's response to the pandemic, it reflected lessons that were learned from past outbreaks, emphasizing very strict containment measures, lockdowns, and public interventions. And, identifying and containing the novel virus was initially very challenging due to its unknown characteristics and sometimes asymptomatic spread. People were walking around with no particular symptoms whatsoever, but they were infected. Then, of course, implementing large-scale lockdowns and quarantines to contain the virus, the virus spread required significant coordination, and it posed economic and social challenges. I mean, think about it. They shut down the entire economy. The stock market crashed. Millions of people lost their jobs. Things got wild very, very quickly. So, of course, the rapid implementation of strict containment measures, including travel restrictions, citywide lockdowns, it was crucial in slowing down the virus's spread. The use of technology and innovative healthcare solutions such as telemedicine and the construction of temporary hospitals under tents in the parking lot, it definitely helped to manage the patient load and reduce transmission. But this was a crisis that we've never seen before. And what we could very well be embarking upon here would be kind of like what the World Economic Forum and the World Health Organization has predicted, but it would be much different than what we've seen in the past, where it was a single virus that pretty much shut down the entire world. What could happen is we could see literally an assortment of third world viruses enter the United States all at once. And we could theoretically see all of these mini outbreaks taking place all throughout the United States because there's so many new people coming into the country without being properly vaccinated, and they may be bringing all sorts of new things to our healthcare system that our healthcare system is not prepared to receive. Think about it. If 10,000 people came into the country in 1 month, look at the State Farm Arena, for example. State Farm Arena only holds 16,000 people in that particular arena. That's where the NBA plays, the Atlanta Hawks and whatnot. Think about any major arena wherever you happen to live, right? If you have a basketball team where you live, think about that arena. That is roughly how many people are coming into the United States illegally every single day through the Texas borders. And a lot of these people are not necessarily vaccinated and may or may not be bringing disease with them. They may or may not be displaying any symptoms. So imagine if this number of people entering the country, imagine the potential impact that this could bring to all those involved. If you guys appreciated this video, definitely hit the like button, consider subscribing to the channel, and I'll see you guys on the next one.